What if losing your sex drive after 40 doesn't mean you've lost yourself? What if your body is simply asking for something different? If you've noticed that your desire isn't what it used to be, I want you to know that there may be more you can do than simply accept it as part of getting older. Because I think that that's the question underneath the question. A woman isn't just asking me, why don't I want sex anymore? She's often asking, is this who I am now? Is this what getting older is going to feel like? Am I ever going to feel like myself again? And my answers don't assume that this is the end of the story. But before we talk about treatment, we have to understand what we're actually treating. Because low desire is not one problem. For one woman, it may be vaginal dryness and pain. For another, it may be poor sleep and exhaustion. For another, it may be depression, anxiety, and medication or another medical condition. And sometimes it is several things happening at once. That's why I don't want to look at a woman and say, your hormones are low, here's your prescription. I want to ask a better question. What happened to your desire? Did it disappear completely? Did it gradually fade? Do you still enjoy intimacy once it begins, but you never think about initiating it? Or has sex become something you avoid because you're afraid it's going to hurt? Those are very different experiences. And they tell me different things. For example, if sex has become painful, I want to address that first. Because imagine touching a hot stove and then wondering why you don't feel like touching it again. If your vagina is dry, the tissues are fragile, or intercourse hurts, your body may begin to anticipate that pain. And over time, you may stop wanting sex, not because you don't love your partner, but because your body has learned that intimacy might hurt. And that's not a character flaw. That's physiology. And we have treatments for the vaginal and urinary changes that can occur with menopause. Depending on the woman, that may include lubricants, vaginal moisturizers, vaginal estrogens, or other therapies. You shouldn't have to tolerate painful sex and simply accept that as part of getting older. But sometimes the problem isn't pain. Sometimes a woman says, nothing hurts. I just don't think about sex anymore. And that is where we have to look at the bigger picture. How are you sleeping? How is your stress? How is your mood? What medications are you taking? Are you having other symptoms of perimenopause or menopause? And what is happening in your relationship? Because sometimes the answer isn't one medication. Sometimes several things need attention at the same time. And then there are medications that specifically address low sexual desire in appropriately selected women. One of them is Addy or flibanserin. Addy is a daily medication that is FDA approved for women under 65 with acquired generalized hypoactive sexual desire disorder, or HSDD, when the low desire causes significant distress or interpersonal difficulty. And then there's another medication called Vyleesi. But Vyleesi is different. It is an as-needed injection, and it is FDA approved specifically for women with acquired generalized hypoactive sexual desire disorder. And these aren't simply sex pills. They're a treatment for a specific condition, and they're not appropriate for every woman. That is why the evaluation matters. For some women, menopausal hormone therapy may also be appropriate, particularly when low libido is occurring alongside other menopausal symptoms. And for some postmenopausal women with persistent, distressing, low sexual desire, testosterone therapy can be considered after an appropriate evaluation. But I want to be clear about something. There is no magic libido hormone. I don't want women chasing a number in a laboratory report when what they really need is a thoughtful evaluation of the entire picture. There's also something else I want women to understand. We often think that sexual desire is supposed to arise spontaneously. You wake up and think, I want sex. But for many women, especially as they move through midlife, desire can become more responsive. In other words, Desire may come after intimacy, affection, touch, or emotional connection begins, not necessarily before. That does not mean you should ever force yourself to have sex. It means understanding that the way your desire works may have changed, and that can be incredibly freeing. Perhaps the goal is to understand the woman you are now, her body, her hormones, her needs, her desires, her relationships, her season of life. So if your libido has changed, please don't make the first question, what is wrong with me? Ask, what has changed? And then ask, what does my body need now? Because getting older doesn't mean becoming invisible. It doesn't mean becoming less feminine. And it doesn't mean that intimacy, pleasure, connection, or desire have to disappear. Your body may be different. Your life may be different, but different does not mean diminished. And sometimes the work of midlife isn't getting your old self back. It's getting reconnected and reacquainted with the woman you're becoming. So understand your body, honor your story, and remember your best season may still be ahead. So until next time, I'm Dr. Ivana. Please continue to bloom.